Hello YouTube family, thank you very much for logging in, and my name is Zeti at Nashville. I do videos to do with healthcare, lifestyle, and just what's up in the medical world, and we discuss and get informed. So today I have come out here because I have been looking into COVID issues. I've been talking about Omicron, and as we know, Omicron right now, many people are coming out with mild symptoms, and this is definitely due to people taking care of themselves, following the MOH protocols. Their coughing etiquette has improved. People are putting on their masks, they're sanitizing, and they're avoiding crowded areas. So, and also the vaccine has really played a very big role in taking down these symptoms. And now, I don't want to say that now everybody is having milder symptoms. We have these people who now develop severe symptoms when they are on home-based care. Now you start developing symptoms that we need to look out for, so that we know when to go to hospital, so that you don't go to hospital when it's too late. Okay, so I have come up with a list of 8 symptoms that you need to look out for, that are danger signs when you're doing your home care. So we said when you're doing home care, you need to have at least some gadgets that you're checking yourself to gauge if you're doing well or you're deteriorating. So these gadgets are your thermometer. You need your thermometer. Either you get an infrared thermometer, or you get the normal digital thermometer, this one, and a pulse oximeter up there. So you can get from all ranges of pulse oximeter, but it's good to check the one that you can be able to interact and use properly. Okay, so now when you have these gadgets, there are things that you're supposed to look out for, and one is your temperature. You need to check your temperature at least twice a day, in the morning when you wake up and in the evening before you get to bed. So in the morning when you wake up, you check your temperature, and if your temperature is 38 degrees centigrade, you take your paracetamol, which is an antipyretic, or any other medication that your doctor has prescribed to, or your home care assistant has prescribed you to, and then you wait up. Most of the time you will either take the medication for every after 6 hours or every after 8 hours. So if you've been checking your temperature despite taking medication, and your temperature is above 38 degrees centigrade for 3 consecutive days, please go and see a doctor, or call your nurse, or call your physician, or call whoever is taking care of you, so that you can go to the hospital. Number 2, if you're taking your oxygen saturations and your oxygen levels are below 95 at room temperature in 24 hours, please go and see a doctor. And I am sure your home care assistant or your doctor has explained to you how to use your pulse oximeter. I'll come back with a video on the same procedure, and we will help each other. Okay, so number 3, if your blood pressure, if you feel dizzy, and if you feel like you're not yourself, you're getting confused, and then you are taking your blood pressure, if you have a blood pressure machine, it is also important to have it when you're doing your home-based care, so that you can know how your blood pressure is behaving, because there's a tendency of developing hypertension or hypotension with COVID. So if you check your blood pressure and your systolic blood pressure, the above blood pressure, the one that is on top, is below 80 millimeters mercury, please go to the hospital. Or the diastolic blood pressure is below 60, go to the hospital. That means you're developing hypotension, so you need to have yourself checked. On the same blood pressure machine, or on your SpO2 machine, and your pulse rate is above 110, please go and see the doctor. So please check out for both readings. Okay, number 5, if you have severe abdominal pain, and this pain is not on the muscle, not on your tummy muscle, it is from inside. You can't sit up straight, you can't sit up, you can't bend like this. So the pain can be either straight in the middle of the abdomen, below the abdomen, the navel cord, or on the sides. please go and be checked. If you develop sign of confusion, if you can see the person you're taking care of is developing confusion and is not able to comprehend, or he's not talking comprehensively, or is just not interested in the environment, please take this person to hospital. Probably the oxygen saturation levels are low. If you don't have an SpO2 machine, that is what causes the confusion, or the sugar levels are low or they are very high. So please take this person to hospital, okay? If our patient has very dark urine, normally our urine is supposed to be either clear like water, amber, or deep amber, but it's not supposed to be dark amber. Dark, that is like black tea, strong tea. Take this person to hospital. It means this person's kidneys are failing and they're not working properly, or this person is severely dehydrated, or probably the gallbladder is not functioning well, or it is obstructed. So take this person to hospital as soon as possible. And our last point, if our patient is not eating, if the person has refused to eat completely, and the person looks very dehydrated, and the person is very dizzy, please take this person to hospital. Those are danger signs, okay? Yes, that is it from me for today, and I hope I was able to enlighten someone, and that is why I'm here. And let us meet in the next video. It is bye from me for today, and I love you all. Keep on sharing and let us get informed. Bye.